Jeez.
Hi, this is Jeanette, and I'm presenting. I do not have currently the ability to share my screen. Lee, can you hear me?
Hi, Jeanette. I can hear you.
Is there any way I can get
Jeanette,
screen?
you should be able to go to more. My internet went out again on
Oh,
me.
to more, and then I'm
Yeah,
not familiar with Zoom. So more, and then
Hmm.
yeah, and then you start share
so I do have a share with like a little with a
arrow.
rectangular box and it won't let me share. It says you cannot start screen share while the other participant
Oh,
is sharing.
yeah. Once he stops sharing this, you'll be able to share.
Okay,
Well, let me go ahead and stop my share just so we know we can get you situated.
thank you. Okay, so screen two. So do you see Illinois Medicaid programs? Do you guys see? What do you
Yes, I
see?
Yep.
can.
Okay. And then you see like we improve lives, just make sure I'm like in what we will cover today. Do you
Yep.
see all
Yep.
that? Okay, awesome. I'm good to go. So Lee, just let me know.
Okay. And thank you. Just to make everybody aware, we've had internet issues in the Chicagoland area due to storms, and my internet is very unstable right now. So Stephen, who usually works in the background, is actually doing is going to take lead with this today. And I am on my phone because my internet is so unstable. We didn't want to take any chances of the recording not being good quality so that we could have this for future for people to be able to access. Because I already have gotten people asking me if we're recording this so, because they can't be here today and they would like to have the copy, be able to watch this later on. So I'm going to just pass it off to Stephen now.
All right, thanks, Lee. We still have another minute
Mm-hmm.
before it's time to actually start. So, um, I should probably wait another minute
Yep.
just to make sure everybody's here.
Yes, because we do have people that typically do are joining right when they
Hmm.
at the mark. So yes.
Yeah, I think I saw the number of participants go up by one as we were saying that.
Yes.
It's an early crowd here, huh?
Hmm.
And we have an hour?
Yes. But sometimes we go a little bit over that. So if there's a lot of questions or you have a lot to say, that's fine.
Okay. Yeah, I won't be monitoring the chat, but we can just tell me when you're ready and then I can start.
All right, sounds good. Um, all right, welcome everyone to the Resident and Family Support Council. We are here today with Jeanette Badrov. I hope I pronounced
Yes,
your name correctly.
yes, thank you.
And she's going to be talking with us about Illinois Medicaid programs for full benefit dual eligible members in 2027. As always, we encourage you to leave questions in the chat, and we will do our best to try and answer them. I'm going to put our ombudsman contact information as well as information about our YouTube channel, our Facebook page, and our podcast. That's all in the chat, so feel free to check out those resources. For our YouTube channel, that is our library of resident and family support council meetings. And we are up to, Lee, are we up to 100 now? Over 100 now?
Yes, we're over 100. We're probably close to almost to 110 now. So yes.
Oh, wonderful. So, with all that said, I don't think I'm missing any announcements, Lee, but am I missing anything?
No.
All
Nope.
right. So, Jeanette, I will hand it over to you.
Thank you. Thank you, everyone, for allowing HFS to present today on Illinois Medicaid programs for full benefit dual eligible members. Before I proceed, I wanted to introduce my colleague Jessica Pickens, who worked with me very closely with me on this presentation. She is also here to support the program and to answer any questions. There is about 45 slides. I will go through the slides. I'm not going to be monitoring the chat, but someone can monitor the chat, and then we can have Q&As after we go through the slides. Also, I wanted to let everybody know that this is our first time presenting. on all the programs that are available in 2027. So we're still working on this presentation, and it will not be ready to be disseminated, this presentation, until sometime at the end of this month. When it is ready to be shared, we will upload it on the HFS's website. We still have to go through some review processes and most importantly, make sure that it's 508 compliant on our website. With that being said, I will start with the presentation. We're going to cover today the Medicaid managed care options for full benefit dual eligible members in calendar year 2027. Those options are called the fully integrated dual eligible special needs plan and the MLTSS duals specialty program. We're going to discuss who qualifies, what the plan benefits are, how if they integrate with Medicare benefits, when certain benefits must be accessed through Medicaid fee-for-service, what the enrollment and disenrollment processes are for each of those plans, and which managed care companies are going to operate these plans in calendar year 2027. So the first question people may ask is, who is a full benefit dual eligible member? And see, there's already a typo here. A full benefit dual eligible member, and we're going to use the acronym FBDE throughout the presentation, is someone who has both Medicare and Medicaid, and most importantly, receives Medicaid's full range of benefits. So when means to have Medicare is that the person has Medicare Parts A and B. Some people only have Medicare Part A. And in order to be a full benefit dual eligible, you need to have the full set of Illinois Medicaid benefits, which means that the member can receive all the range of services that Illinois Medicaid offers. An example of a person who is not a full benefit dual eligible member for comparison are those persons enrolled in the Illinois Breast and Cervical Cancer Program because they receive a limited set of services. And those services are mammograms, breast exams, pelvic exams, and Pap tests. So, for example, people in the BCC program will not receive an annual physical exam that persons with full set of Illinois Medicaid benefits are entitled to. We at HFS like charts. Here is a chart of what a full benefit dual eligible member has and what a partial benefit dual eligible member has. And again, both have Medicare Part A and B, but the difference is that the partial benefit member does not have full Medicaid benefits. Full benefit dual eligible members are the persons that we're going to talk about today, and those are the persons that are eligible for the programs that we're going to talk about today. The first program at FBDE is eligible for is called a fully integrated dual eligible special needs plan. FIDE SNP for short. What is a FIDE SNP? A FIDE SNP is a fully integrated dual eligible special needs plan, which is a type of Medicare Advantage plan. So it's a Part C plan that provides both Medicare and Medicaid benefits through a single managed care plan. So you don't have Medicare and Medicaid in two separate plans, you have them in one plan. Again, FIDE SNPs are for Illinoisans who receive both Medicare and Medicaid. FIDE SNPs simplify the delivery of Medicare and Medicaid benefits by coordinating benefits from both programs with the member as the focus. FIDEs are available in every county in the state of Illinois. For those of you who are familiar with D-SNPs, there are many types of D-SNPs, dual eligible special needs plans, that are available across the country, but the only FIDE SNPs are available in Illinois. And why does Illinois only use FIDE SNPs? Because it's the only type of Medicare Advantage plan subject to regulatory oversight by the state of Illinois. So the Illinois Department of Healthcare and Family Services partners with the Centers for Medicare and Medicaid Services to operate this program. CMS oversees the Medicare benefits, and HFS oversees the Medicaid benefits. FIDE SNPs, again, must have approved contract with CMS to cover Medicare benefits and an approved contract with HFS to cover Medicaid benefits. More reasons why Illinois uses a FIDE SNP is it provides a highest level of coordination of Medicare and Medicaid benefits. It provides the highest level of integration because it combines Medicare and Medicaid under one managed care plan. Medicare is the primary payer for most healthcare services, including primary care, specialty care, acute and post-acute healthcare, home health, and medical equipment. Medicaid wraps around Medicare by paying Medicare Part A and B cost sharing. So if you're in a FIDE SNP, you do not have to pay any of your Medicare Part A and B cost sharing. It's very important to know. And it covers some services that Medicare does not cover, such as long-term services and supports. So those are your long-term nursing facility stays, your 1915C waivers. It focuses on the member. It's member-centered because it simplifies care, services, and supports through such measures as one member handbook. So you have only one member handbook to see all your Medicare and Medicaid benefits. You have one unified appeals and grievance process for all your Medicare and Medicaid benefits. And you have one provider directory. So you don't have to go through Medicare to see what your provider directory is and then through a separate Medicaid provider directory. It's all located in one directory. The plans that operate the FIDE SNPs who are under contract with HFS are called Aetna Medicare FIDE. CMS mandates that the HMO DSNP is in every title. So then when you go to Medicare.gov and you look for your enrollment options, you're going to notice that it has HMO DSNP, which indicates that it is a dual eligible special needs plan. Humana Dual Fully Integrated, again, HMO DSNP. Molina Medicare Complete Care Plus, again, HMO DSNP. And WellCare Meridian Dual Align, HMO DSNP. So this program went live January 1, 2026. It replaced the MMAI program. For those of you who are already enrolled in a FIDE SNP, these names should look familiar to you. The FIDE SNP provider network consists of providers having to have contracts with the FIDE SNP managed care plan. So a provider has to contract with one of these plans to deliver services and benefits to FIDE SNP members. Those are known as in-network providers. Most of the time, members must see primary FIDE SNP in-network providers. There are certain instances, just like in Medicaid, where a member is allowed to see an out-of-network provider. The network must meet both CMS Medicare provider network adequacy standards for Medicare services and HFS Medicaid provider network adequacy requirements for Medicaid services. For a comprehensive list of in-network providers, contact the FIDE SNP managed care plans or visit their websites. Their contact information and their websites are available on HFS's FIDE SNP page. We wanted to put a slide in here to talk about the FIDE SNP lookalike plans. So there's plans that are called chronic special needs plans. Those chronic special needs plans do take full benefit dual eligible members, and they do take enrollment, but they are not DSNPs. So only the managed care plans that I mentioned on the previous slide with HMO DSNP in the name are the authorized FIDE SNPs in Illinois. The C-SNPs look alike a FIDE SNP because it does allow for duals to enroll, but again, they do not have the contract with HFS and they do not provide the care coordination or wraparound services offered by a FIDE SNP. So for example, if you're enrolled in a C-SNP, The C-SNPs do not pay the Medicare Part A and Medicare Part B cost sharing like the FIDE SNPs do. So when making a Medicare enrollment decision, please be sure to ask whether the plan is a FIDE SNP. Who is eligible for a FIDE SNP? Individuals who meet the FIDE SNP eligibility criteria, so they're full benefit dual eligible. Again, that is a person who receives full Illinois Medicaid and enrolls in either the Medicaid Aid to the Age, Blind, and Disabled, AABD, or the Family Category of Assistance, and they have Medicare Part A and Medicare Part B insurance. You have to be age 21 and older at the time of enrollment. You have to live in the service area. So since it's statewide, you just need to live in Illinois. And you have to be a U.S. citizen or lawfully present in the U.S. You also could meet all these eligibility criteria, but you could fall under an exclusion criteria. So if you meet all these eligibility criteria, but you receive developmental disability institutional services or are participating in the HCBS waiver for adults with developmental disabilities, you cannot enroll in a FIDE SNP. If you're a Medicaid spend down, you cannot enroll in a FIDE SNP. If you have a comprehensive third-party insurance, you cannot enroll in a FIDE SNP. There is something called a FIDE SNP deeming period. And what that means is a deeming period allows members who lose Medicaid eligibility to remain in their FIDE SNP for a certain amount of time. In Illinois, that amount of time is 90 days to 6 months. That deeming period changes per FIDE SNP, and you'll have to look at each plan's member handbook to understand how long each plan has a deeming period for. But in Illinois, it's a minimum of 90 days. Under federal law, it's a maximum of 6 months. During the deeming period, members receive only Medicare benefits because during the deeming period, you have lost Medicaid eligibility. So you cannot receive Medicaid benefits from a FIDE SNP during the deeming period. Enrollment in the FIDE SNP continues if Medicaid is reinstated by the end of the deeming period. Otherwise, FIDE SNP enrollment and, most importantly, Medicare coverage through the FIDE SNP ends when the deeming period expires. If a member's full Medicaid benefits are reinstated during the deeming period, Medicaid coverage in the FIDE SNP will be effective the first day of the month following reinstatement of Medicaid. If FIDE SNP enrollment ends, it's important to note that the member must enroll for Medicare benefits either through original Medicare with a Medicare drug plan or select a non-D-SNP Medicare Advantage plan. Because you're no longer eligible for a FIDE because you don't receive Medicaid benefits, a FIDE SNP, you are no longer eligible for any kind of D-SNP in Illinois. And the only kind of D-SNP, again, available in Illinois is a FIDE SNP. Just an important note about Medicare Advantage plans. Most of them cover prescription drugs. Some of them do not cover prescription drugs. If a Medicare Advantage plan does not cover a prescription drug, you must also select a Medicare drug plan. If you do not choose a Medicare drug plan, CMS will assign members to a Medicare drug plan. So a little bit about FIDE SNP enrollment and disenrollment. Enrollment is voluntary, so Illinois does not require a full benefit dual eligible to enroll in a FIDE. FIDE SNPs manage member enrollment and disenrollment. So the plan itself enrolls. HFS does not enroll these members. The next slide will show how to enroll in a FIDE SNP. HFS also currently will not automatically enroll a person who becomes eligible for a FIDE SNP through at least mid-calendar year 2027. Disenrollment and FIDE SNP changes. Members may enroll in or disenroll from a FIDE SNP at any time. So you can jump, not that we advocate for it, but you can choose and jump between FIDE SNP plans monthly. Members may switch between FIDE SNP plans. And again, the option to enroll and disenroll in a FIDE SNP only applies to the 4 FIDE SNPs named. You cannot enroll in or switch to a non-FIDE SNP Medicare Advantage plan at any time. There's only certain times where you can enroll and disenroll from a FIDE SNP and enroll in a Medicare Advantage plans. At the end of this presentation, we have itemized what those Medicare enrollment events and dates are, what your Medicare coverage options are, and what your Medicaid coverage options are. FIDE SNP health plans may market plans during Medicare open enrollment, which begins October 1st. The marketing period begins October 15th, I believe, is the day it is open for enrollment. And unlike with MMAI, Medicare brokers may enroll members and receive compensation under Medicare Advantage rules. So for a FIDE SNP, because it's a Medicare Advantage Part C plan, brokers are able to enroll members.
Hey, Jeanette, we had a question come up.
Mhm.
The question is a FIDE SNP member liable for Medicaid service costs or otherwise Medicaid's cost sharing during the deeming period?
So there's no Medicaid at all during the deeming period because you've lost Medicaid eligibility during the deeming period. So you're no longer eligible for Medicaid.
All right. Sergio, if that doesn't answer your question, feel free to leave another message in the chat. So thank you.
You're welcome. So a member who wants to enroll in a FIDE SNP can always call the plan, can enroll with a broker. But you can also do yourself by visiting Medicare.gov. You have to select the Find Plans Now button and then follow the steps to view the Medicare Advantage Part C plans that are available in your zip code. You have to make sure to select Medicaid when asked if you get help with your Medicare health or drug costs, because then it'll give you those FIDE SNP options. And again, a FIDE SNP has a contract with HFS, so it does have Medicaid options and Medicaid services in the plan, unlike a C-SNP. You can also, like I said, call the plan or visit their website, and you can also call 1-800-Medicare. So what are your Medicare and Medicaid options for full benefit dual eligibles not enrolled in a FIDE SNP? So we went through this briefly earlier in the presentation. So the Medicare options are if you're not enrolled in a FIDE SNP, again, you don't have to enroll in the FIDE SNP. So if you don't want to enroll in the FIDE SNP, and you do have Medicare eligibility, so you can go to Original Medicare with a Medicare drug plan or a Medicare Advantage plan with or without a drug plan. Again, it's very important to note that if you do not select a Medicare Advantage plan with a drug plan, CMS will automatically assign a drug plan for you. Full benefit dual eligible means that you're eligible for Medicaid services, but that doesn't mean that you can forego a requirement to enroll in a Medicare Part D drug plan. So if you're Medicare eligible, you must enroll in all the Medicare options available to you. Medicaid is secondary. What is your Medicaid coverage if you choose not to enroll in a FIDE SNP? Well, that Medicaid coverage depends upon your status and whether you receive long-term services and supports. So long-term services and supports are those persons who are in nursing facilities or receive 1915C waiver services. If you are a full benefit dual eligible and you receive LTSS services, you must enroll in what we're now calling the MLTSS Duals Specialty Program. So we just named this program yesterday. It is the same program for members who are currently enrolled in the program in what is called the Health Choice Illinois program. And we're going to go in this presentation and explain more about this program, which we have now named the MLTSS Duals Specialty Program. Again, if you receive LTSS services and you're a full benefit dual eligible and you're not enrolled in a FIDE SNP, you have to enroll in this MLTSS Dual Specialty Program. Members must use their MLTSS program Managed Care Plan ID card to access the MLTSS program services. And it is a specialty program because not all services, not all Medicaid services are available in this plan. It is a limited Medicaid package, and we'll go more into what that limited Medicaid package is. So because it is a limited Medicaid package, members also may receive, even though you're enrolled in this MLTSS dual specialty program, members may also receive some services in Medicaid's fee-for-service program. And those services are neither covered in the MLTSS program nor covered by Medicare, because remember, you are Medicare eligible, so most of your primary care services, et cetera, will be covered by Medicare. And so some of the services that you may receive in fee for service, if you're enrolled in the dual specialty program, are non-Medicare prescription drugs, non-Medicare home health, or non-Medicare durable medical equipment. In order to access the fee for service items, you need to use your HFS medical card to access these Medicaid services. So if you're a full benefit dual eligible that does not receive any sort of LTS services, you are not required to enroll in the dual specialty program because it's only for people who receive LTSS services, and you'll receive your Medicaid services through fee for service. So again, a full benefit dual eligible not receiving LTS services, who is not enrolled in a FIDE SNP, has to enroll and receive Medicare coverage through some other means that is not a FIDE SNP, and they will receive any sort of Medicaid services through fee-for-service. Now we're going to talk more about this MLTSS dual specialty program. Who is eligible? You're eligible if you're a full benefit dual eligible. You're eligible to enroll, but not enrolled in a FIDE SNP. You're age 21 and older. And again, the important distinction is you receive long-term services and supports based on the assessed need for nursing facility level of care. So what that means is nursing facility residents, persons participating in the 1915C waivers, and you have to participate in these waivers. So the persons who are elderly, persons with disabilities, persons with HIV/AIDS, persons with brain injury, and persons residing in supportive living facilities. So early in the presentation, we stated that if you're an adult in the developmental disability waiver, you are not eligible for a FIDE SNP. You'll also not be eligible for an MLTSS duals specialty plan.
Jeanette, we had a couple of questions pop
Sure.
up into the chat. Kathy asked, LTSS plans for 2027. Blue Cross is ending contract. I have PPO Medicare Advantage and I am dual. So for my LTSS, what do I do? And I think probably the answer would be to call a state health insurance program counselor.
Yes, you can call the state health insurance program counselor, but if you're receiving full Medicare, full Medicaid, and you're in BCPS, LTSS, Health Choice Illinois, and you're a dual, you can enroll effective January 1, 2027. You can enroll in one of these plans, which we haven't gotten to yet.
Okay.
Yeah.
And then the next question, which is relevant to what you've just been talking about. I'm sorry, I'm going to butcher your name. Radhika asked, does this mean people receiving home and community-based waiver services will only be eligible for those through the FIDE SNP MLTSS. And then she added anyone with Medicare and FFS Medicaid will not be eligible for home and community-based services unless they enroll in a FIDE DSNP MLTSS.
So I wouldn't put it that way. I would say you're eligible for your 1915C waiver services based on those waiver requirements. The because you're eligible for the waiver makes you um, eligible for being enrolled if you receive Medicare Parts A and B. Um, you're eligible for a FIDE SNP or this MLTSS duals eligibility. So your eligibility for the waiver is what makes you eligible for these programs. It's not like the reverse, like the question is asking.
Okay, wonderful. Thank you.
You're welcome. Let's see, okay. So I think this covers a little bit of the question. So the MLTSS program benefits are behavioral health, non-emergency medical transportation, again, nursing facility, and 1915C HCBS waiver. The MLTSS program managed care companies must abide by the rules and policies provided in each waiver. And again, non-emergency ground ambulance services not covered by Medicare shall continue to be carved out of managed care and deliver via fee-for-service. So again, it's important to know what the MLTSS dual specialty program is covering is these services, behavioral health, NEMT, nursing facility, and 1915C waivers to the extent that these are not covered by Medicare. Because again, you have Medicare, so Medicare is going to be primary. Now, Medicare doesn't cover any sort of waiver services. So you're going to receive all your waiver services through the MLTSS dual specialty plan. So current state for this program, again, we just changed the name, is that they're in the Health Choice Illinois program. So one of the Health Choice Illinois programs that delivers has a contract with the state for a the specialty program is BCBS. Effective January 1, 2027, BCBS and County Care will no longer be able to, will no longer have a contract with the state of Illinois to deliver MLTSS program services. And only Aetna, Humana, Meridian, and Molina will have that contract. And the reason is, as these health plans were awarded the program in the DSNP RFP. Again, covered services and eligibility remain unchanged. So the only thing that's changing in 2027 is the health plans that are allowed to deliver the MLTSS program services. So we're getting a little bit in the weeds here, and going to talk about what happens to County Care and Blue Cross enrollees. So County Care and Blue Cross will not have, again, MLTSS program contracts with HFS effective January 1, 2027. So effective July 6 of 2026, County Care and BCBS were not listed as plan choices on member open enrollment letters sent by HFS's Illinois and Client Enrollment Services. Beginning, and again, this is a lot to digest. We're going to post this on our website. Beginning August 13, 2026, HFS will no longer place, sometimes called auto assignment, newly eligible MLTSS program participants in County Care and Blue Cross, and the Illinois Client Enrollment Services will not list them as plan choices on the initial auto assignment letters. Through August 31st, 2026, members eligible for the MLTSS program will be able to enroll themselves in Blue Cross and County Care. But after September 1st, no one will be able to enroll in the County Care or Blue Cross MLTSS program because that program ends December 31st, 2026, just with County Care and Blue Cross. Again, it will continue under the same coverage and the same eligibility criteria except the plans are now Aetna, Humana, Meridian, and Molina. Because member enrollment is mandatory, County Care and Blue Cross members will be reassigned to either Aetna, Humana, Meridian, or Molina effective January 1, 2027. County Care and Blue Cross members will receive a letter from the Illinois Client Enrollment Services sometime in October 2026, notifying them of their new MLTSS managed care plan assignment, again for January 1, 2027, which may now include Humana. County Care and Blue Cross MLTSS members will have the option to choose a different managed care program, including Humana, through March 31st, 2027. So County Care and Blue Cross members are going to receive a letter, and it's going to say here, you have the option as of January 1st to enroll at Aetna, Humana, Meridian, Molina. If you do not make that option, we will assign it to you. But again, after even the assignment takes place, so after January 1st, 2027, these members have through March 31st, 2027 to switch MLTSS program, or again, like I stated earlier in this presentation, you can enroll in a FIDE SNP anytime. If you choose not to enroll in a FIDE SNP and you want to stay in an MLTSS plan program, after March 31st, you cannot switch to another MLTSS plan until your annual open enrollment period.
We had another question in the chat. Okay, can I have my dual C-SNP POP Medicare Advantage plan, but for my LTSS choose one of the four? What we can't choose.
So if you're in a C-SNP and you're a dual, you are going to be in an MLTSS because you're full benefit dual eligible. If you're full benefit dual eligible. So in a C-SNP, again, I'm not that as familiar with the C-SNP, but if you're full benefit dual eligible, which some C-SNP members are, and you meet the criteria for the MLTSS specialty program, you will have to choose one of the four.
Okay, thank
And you
you.
receive LTSS service. So the important distinction is you have to receive LTSS services.
Okay. And we just had another question pop up. If they get auto-enrolled but have original Medicare slash fee-for-service Medicaid, will it just auto-enroll them into the MLTSS and not affect their original Medicare Medicaid? Or will it change them to the FIDE plan for all medical?
We're not going to change anyone to any FIDE plan because enrollment in a FIDE is voluntary. We're only going to enroll you in the MLTSS specialty program if you receive long-term services and supports. So the way I understand that question is you're receiving Medicaid fee-for-service. You're currently not receiving Medicaid from any managed care plan. So I'm assuming, based on that question, that you are not eligible for the MLTSS specialty program because you're not enrolled in an MLTSS specialty plan currently. Can you verify
And
that?
um,
Okay.
the person who asked the question, Leah, says, "Thank you, I was confused." So it sounds like you answered her question.
Okay.
Thank you.
You're welcome. Any other questions? These are all great questions. This is very confusing.
Kathy put something into the chat, but I'm not sure the context, what she's talking about. So, Kathy, if you could type a little bit more into a message, that would be fantastic. But until then, go right ahead and continue.
Jeanette,
Yeah.
this is Jessica. I just want to, I think up above when Kathy was typing, and you may have, you clarified it, but I think it's worth clarifying one more time that when Kathy said what we can't choose, I think that just reiterating the distinction is that when the letters come out, you do have the ability to choose. The letter will tell you who you will be auto assigned to if you do not choose. So I just want to reiterate that and make that clear. That's all,
Correct.
Jeanette. Thank you.
Yeah, thanks. And then again, even if, so that letter is going to tell you what's going to happen January 1st. And then that letter will also say, even after January 1st, you still have an opportunity to choose. So you make a decision, you're enrolled in either Aetna, Humana, Meridian, or Molina for the MLTSS specialty plan on January 1st. You still have until March 31st to switch the plans. Because say you don't like the services you're receiving or your provider's not in network, you can still switch through March 31st. Okay, let's see here. If you're currently enrolled in Aetna, Meridian, and Molina in their MLTSS specialty program in calendar year 2026, what's going to happen is that you're going to be transitioned to Aetna, Meridian, and Molina, their new contracts with the state. Again, same program, same eligibility. It's like the same plan services because the plan cannot change the services. The services are controlled and eligibility is controlled by HFS, but you're going to have to receive a new member ID card because it is a new contract, and then federal law requires just new contracts to have like new member ID cards. So these plans, not HFS client enrollment services, these plans will be sending members of, their members, Aetna, Meridian, Molina, a new identification card and a letter explaining that their enrollment has been transitioned effective January 1, 2027. Again, like with County Care and Blue Cross, you have until March 31st to choose another MLTSS managed care plan. And again, that plan choice will include Humana. And again, it will not include County Care and Blue Cross. And then just like with County Care and Blue Cross members who are transitioned, if you stay in the MLTSS plan, you can enroll in a FIDE SNP at any time, but you can only switch plans after MLTSS plans after March 31st in your annual enrollment period.
So Kathy expanded on her question. She said, with my special needs PPO, I have BCPS, LTSS. Can I have both Medicare Advantage and the LTSS?
Yeah, so right now, Kathy's enrolled in a chronic special needs plan, and she's enrolled in the BCBS calendar year 2026 specialty plan. So, Kathy, you're going to receive a letter from Illinois Client Enrollment Services giving you either Aetna, Humana, Meridian, or Molina as options to enroll for your long-term services and supports on January 1st, 2027. And then you can choose any one of those. But if you don't make a choice, that letter is going to tell you what plan you're enrolled in if you don't make a choice. But you're still going to receive the same services that you receive from Blue Cross.
Thank you.
You're welcome. And what we're also going to do, which this presentation doesn't go into, when we're looking at who to auto assign members to for Blue Cross and County Care, we are going to look at who your providers are for your long-term services and supports. So we are going to try to align the providers so that you don't go to a plan that does not have a provider in network. So this, we're running like shorter time, it's like 3:41. This is a very dense slide. And again, we're going to post this on the website. But what this slide goes into is what happens in 2027. So we're not talking about Blue Cross members and County Care members and all the members that are being transitioned in 2027. We're talking about what happens, transition in 2026, effective January 1, 2027. We're talking about now all the transitions have taken place. What happens to full benefit dual eligibles in terms of their FIDE SNP when they disenroll from a FIDE SNP? So if you disenroll from a FIDE SNP again and you receive LTS services, you must be enrolled in a MLTSS program. So If you're enrolled, for example, in an Aetna FIDE SNP, and you disenroll from that Aetna FIDE SNP, HFS is going to enroll you in the Aetna MLTSS specialty program. Again, you have options to choose other MLTSS plans, but if you just decide that you do not want to stay in a FIDE SNP, you're going to be enrolled in the MLTSS specialty plan of that FIDE SNP in 2027. When a member is not enrolled in an HCI plan and is newly eligible for the MLTSS program, so you become, like, for example, you're an HCI and you're receiving both Medicare Parts A and B, the Illinois Client Enrollment Services will send you a letter stating the effective date of your MLTSS program managed care plan if you have not enrolled in a FIDE SNP. So again, you become Medicare eligible at this point. You're in the HCI program. You can go through original Medicare. You can go through a C-SNP, even though we don't recommend going through a C-SNP because of the care coordination, and the lack of unified appeals of grievances and provider directory. You can go through original Medicare, but if you're receiving long-term supports and services and meet the other eligibility criteria for MLTSS specialty program, you will have to enroll in an MLTS specialty plan. The Illinois Client Enrollment Broker will send you a letter stating the enrollment terms, who you're going to be enrolled to if you don't make a decision, and then you have 90 days to switch plans after your effective date. So beginning January 1, 2027, for a member enrolled in Aetna, Humana, Meridian, or Molina HCI who gains Medicare Part A and B, and you don't enroll in the FIDE SNP, you will be assigned to their affiliated MLTSS program. Again, you have an option to choose a different MLTSS program. And again, beginning January 1st, 2027, for Blue Cross or County Care members who gain Medicare Part A and B and do not enroll in the FIDE SNP, the Illinois Client Enrollment Broker will send you a letter stating the effective date of your program enrollment, explaining you have 30 days prior to the effective date to choose a different program, and after the effective date, you have 90 days to switch plans. So in 2027, again, if you're eligible for an MLTSS specialty plan and you're not enrolled in a FIDE SNP, one way or the other, you will have to be enrolled in the MLTSS specialty program.
So we had another question.
Mhm.
Can a person have the LTSS for their waiver service only and still keep a separate plan, either original Medicare or a MAP, for their medical coverage only? This is how it is now. I just want verification that a person can have options for medical.
Can you repeat that question? I'm sorry.
Can a person have the LTSS for their waiver service only and still keep a separate plan, either original Medicare or a MAP, for their medical coverage only?
Yes, so you can have original Medicare and you can have, if you're original Medicare, and you can have the MLTSS specialty plan for your waiver services. Is that the question?
I
You
think
can't be
so.
in
Yeah.
fee for service because you're receiving
Yes.
LTSS. So you have to be in an MLTSS specialty program.
Okay. They said thank you. So
Okay, you're welcome. For MLTSS enrollment, unlike the FIDE SNP, so FIDE SNP, the plan enrolls, the FIDE SNP plan enrolls, the Illinois Client Enrollment Broker is going to do all the enrollment. So this slide tells you, again, it hasn't changed. You have to call the Illinois Client Enrollment Services. Here's the number. Again, we're going to post this on the website. The information hasn't changed from what it is in 2026. There's frequently a lot of questions about continuity of care and like switching between managed care plans. So MLTSS program, the managed care plans has to follow the federal continuity of care requirements. So if you're receiving a certain treatment from a certain provider and you switch MLTSS plans, that new plan has to follow that treatment and provider for a certain amount of days. And that's, again, hasn't switched from 2026. Managed care plans can share your provider information with each other as a permissible HIPAA disclosure. And again, I like being repetitive because it takes a lot of, sometimes it takes a lot of different ways to say the same thing to understand it. And the MLTSS programs, the managed care plans, they will be sending new welcome packets and identification cards for January 1, 2027. So if you are in Aetna, so even if you're in Blue Cross and County Care, they're gonna the Illinois Claim Enrollment Broker is going to send you a letter saying you're going to be enrolled on a certain date, but that managed care plan is also going to send you a hi, welcome to a MLTSS specialty program, either Aetna, Humana, Meridian, or Molina, and here's your identification card. They will have a separate, unique provider network and directory. So you'll be able to see on each website for each MLTSS managed care plan, you will be able to see who are the providers are in their network. We always like to plug in a note about redetermination. So again, it's important to know that you have to be enrolled in Medicaid to be eligible for FIDE SNP or the MLTSS specialty program. Enrollment in either the FIDE or the specialty program does not trigger a Medicaid redetermination. So enrollment in a Medicaid managed care plan does not trigger Medicaid redetermination. Members eligible for the FIDE SNP are AABD and family care category of assistance, and they're required to renew the coverage once a year. So the annual redetermination still applies to the persons who are eligible for FIDE SNP and the MLTSS because they fall under AABD and family care. Please watch for your renewal notice in the mail and respond promptly to avoid interruptions in coverage. Redetermination is a way for you to update your information to see if you still qualify for Medicaid. Again, you cannot qualify for Medicaid or the MLTSS program unless you also qualify for Medicaid. And here's the AIB customer service number on the end of this slide. Now, I'm not going to go through all this, but here's some key information. Again, this will be posted on the website. We appreciate your patience as we're finalizing this presentation. We have itemized like what the different program elements and what the eligibilities are for the FIDE SNP, Medicare Advantage plans that are not FIDEs, and the MLTSS dual specialty program. So it's a good comparison chart of everything. The copays have changed this year. I don't know if members are familiar with the copay changes. Again, this applies to all Medicare Advantage, not just FIDE. So this year, all the full benefit dual eligibles who qualify for FIDE qualify for the extra help program. And so your copays for generic drugs are up to $5.80 this year. And for brand name drugs are up to $14.40. Again, FIDE SNP is a Medicare Advantage plan. So you're going to be subject and you have to use your Medicare prescription drug plan before you can use your Medicaid prescription drug. And you will have to abide by the Medicare cost sharing rules for prescription drugs. A FIDE SNP only pays for cost sharing for Medicare Part A and B. It does not pay for cost sharing for Medicare Part D. Okay, here at the end of the slide is Medicare enrollment events and dates. So this slide goes into why a FIDE SNP member is eligible to change plans at any times or FIDE SNP plans at any times. And here's your key Medicare enrollment date. So open enrollment October 15th, what it allows you to do, etc. Information on the CMS website, and then some resources that will be available to you. With that said, I have finished the presentation. It's a lot of information.
And a lot of
any questions, see hfs.dsip inquiries box. I man that email box, so give me patience. I'm the only person that mans it, so give me patience for answering questions.
Also, Jeanette, I had a direct question that I just want to make known for everybody.
Sure.
So I was asked whether we will be creating flowcharts to help people navigate this, and we
We are
will.
working
That
on
is the
that.
first thing
Yeah.
I asked Jeanette. So we will be working on those,
Yeah.
and those, once we get them done and finalized, those will be posted as well. So I just want to make sure everyone had that information.
Wonderful, wonderful. And thank you so much for presenting for us. Um, I don't see any more questions in the chat, so what I'm going to do now is I'm going to turn off the recording and see if there's anyone who wants to ask any questions without the recording being on.
Hey, Stephen, this is